Welcome back to Worldview. Now, what would you do to save your child's life? Well, this is the Monday Line. I'm Dennis Campbell. Now, all of the inside the Beltway Syria speculation, this all seems so hollow. I did a live segment for BBC Radio before the John Kerry-William Hague meetings yesterday, and after a while, it just all becomes white noise, the kind you tune out. It's easy to do when one considers the less glamorous but just as important life and death situations parents face daily about medical care for their children. And it's even more disturbing when corporations in the business of providing health care decide who lives and who dies on the basis of how much money they can bring to the self-proclaimed, quote, greatest healthcare system in the world. Well, that greatest healthcare system is ranked 37th and falling, with good reason. On Friday, I interviewed a very private, very quiet, dignified man whose two teenage daughters each daily face and fight terminal illnesses. They live under the thumb of a monolithic, impersonal, bottom-line focused, insurance-dominated U.S. healthcare system that has but one simple rule. Don't get very sick or ever need massive amounts of healthcare services. At that point, you're merely numbers on a sheet of paper to be eliminated. And as you'll see in the piece that we did yesterday, you can be threatened by an insurance company to the point where you're either fired or the entire company's healthcare coverage system is placed at risk. You must leave a job you love and are good at doing to find another lower-paying job to get some healthcare coverage. And then you're still on the hook for payments of hundreds of thousands of dollars in premium increases and out-of-pocket expenses because of the risk you pose to their bottom line. Forget that insurance actually used to mean paying premiums and then being there for you when you needed them. These companies loan you their umbrella when the sun is shining, then demand it back the minute it begins to rain in your life. And that's just sick. And rather than fix the system, the playing field is tilted by lawmakers. They purchase them, and hundreds of thousands of Americans are forced to face bankruptcy and the loss of every asset they have ever earned, just because a loved one got sick. The public contract is non-existent. If your care costs too much, they just say no. And then they ask you to go someplace else and die quietly. Now, U.S. insurance companies and hospital systems hold a gun to your head. They tip you upside down and shake out every last penny they can. They live to say no, because by saying no, their profits go through the roof. You, on the other hand, are forced to hire a lawyer and sue these companies with 1,000 plus legal staffs who live for that moment to further bleed you dry, and they do so very slowly, because if you die, so does your case. It is, in a word, despicable. Now, Otto and Chris Kyriakides played by all the rules. Their two daughters face massive medical treatments and bills. Lauren, age 16, has a disease called ITP, idiopathic thrombocytopenic purpura, which, to put it simply, had no known cure. It attacks the autoimmune system and eventually leads to pulmonary failure. Keyword in the disease name is idiopathic. That means no one knows where it comes from. You cannot even begin to imagine the dozens of surgeries, liters of blood transfused, and extended hospital treatments for this young lady. Their older daughter, Stacy, 18, has an equally debilitating and terminal autoimmune disease. These two ladies are quite remarkable forces of nature and were profiled in the Orange County Register. When Otto gets to the point in our interview where he has to make sure both daughters are treated in the same hospital room, I defy anyone reading or watching not to be moved. Now, for the first time, a potential cure has been found for Lauren, their youngest daughter. Doctors at the National Institutes of Health in Bethesda, Maryland, in 33% of the cases where a complete autoimmune system transplant occurs, the patient survives and goes on to live a normal life. After 16 years of multiple treatment surgeries and doctors saying she could not survive beyond the age of 10 or 11, 16-year-old Lauren and her family know it's now or never. They want to do this for a chance at a normal life. So, a potential cure found. There's one donor worldwide that's a perfect match. Doesn't that sound like the perfect Hollywood ending? Not so fast there, Bunky. As Otto said in the interview, there are a few conditions to be met first, and you know where this is headed, don't you? First, the operation has to be started within the next 90 to 180 days. Otherwise, the success chances diminish exponentially. Otto and Chris have to find a hospital that can do the surgery. That means they've performed it before, and it's in their insurance network. Then they have to find a donor that's insurance acceptable. Remember, there was only one in the world discovered, so no one in the family is a match. And if this was not enough, any hospital requires an $800,000 to $2 million US cash deposit before even considering admitting Lauren for surgery. Now, amazingly, Otto and Chris count their blessings every day. Perhaps you can understand why this story stays with me. And perhaps you can now see why all this oxygen wasted on Syria's Assad is just lost here. We'll be right back.